yields back. Dr. Conaway, you are recognized for 5 minutes, or 7 minutes, I'm sorry.
Thank you, Mr. Chairman, and thank you, Secretary Collins, for being here today and answering questions. In the interest of time, I'm going to ask you a series of yes or no questions, just in the interest of time. I'm very concerned about what this administration is doing to safety net programs such as the Supplemental Nutrition Assistance Program, otherwise called SNAP, and Medicaid. The cuts to those programs that are proposed are, in my mind, completely unacceptable and will put many people at risk. Many of our veterans rely on these services to put food on the table and to access health care coverage. If any veteran loses their Medicaid coverage during this administration, would you allow those veterans to be eligible for VA health care under Priority Group 6 to receive health care coverage? Yes or no, if you would.
At this point in time, I don't foresee any of that happening, so I'd have to take it as it came and look at it as if it happened, if that was an understanding. That's not something that we've dealt with so far.
I'll take that as a no for the moment.
Take it any way you need to.
If any veteran loses their nutrition benefit during this administration due to change in the law, as you know, there are some drastic proposals out there in my view, would you be open to directing the VA to provide cash subsidies for those veterans who've lost that important food security program?
Veterans are exempt from the SNAP work requirements. They're not included in these issues.
Well, but if the SNAP, well, the work requirements are a separate issue on the SNAP, as you know. The SNAP program itself, if it's cut, that means people are not going to be able to get the SNAP benefit at all. And so my question is, and I'll ask it again, would you be open to directing to replace that money? You have the authority to do this with cash subsidies to make sure that veterans are not food insecure.
But veterans are not a part of the program that's been described as what is passed.
But yet they're on SNAP. I'll move on.
So they'll continue to get their SNAP program.
Well, if the program is cut by $230 billion. So let me just move on.
I appreciate it.
What do you intend to do about veterans who can't? Well, let me move on. I have significant concerns regarding DOJ's access to VA data. Specifically, I'm worried about their access to sensitive personal veteran data. Secretary Collins, can you ensure this committee that DOJ personnel who have had access to VA data have not retained any copies of that data?
Yes, and they follow all the personnel and all strategic information as any employee would at the VA.
Can you commit to this committee that no personal, or sensitive veteran data such as Social Security numbers, driver's licenses, medical records, or financial records have been retrieved or will be retrieved by DOJ after, I guess, their time in service ends, and that those employees haven't stored that data elsewhere or have used it for personal gain?
There is no even resemblance of anything that would happen in that regard.
The VA is a major player in medical research and innovation. How many researchers have been fired or dismissed from the VA?
None.
How many research projects and studies have been impacted due to the firing of researchers? We have a lot of reports about clinical trials not being disrupted or being canceled or otherwise postponed or paused.
Dr. Conaway, I'm not trying to evade your question, but I do need to draw a distinction here. Are we discussing research trials or are we discussing clinical trials?
Clinical trials.
Okay, clinical trials. There's no clinical trials has been halted. Now, if there have been other issues that may have done it, but none has been canceled, the research trials, the clinical trials. Let me also say something, and I want to get this out because it's important. There's over 1,500 clinical trials going on right now, and of which this is hopefully not going to shock you, but did you realize that we have no centralized control over those clinical trials? I have no idea. No one person is overseeing those. So to get those information and to find out what's going on some of those, we have nobody that's actually over those, but yet we have 1,500 that are actually going on currently.
I suspect many of those trials, because I work in this area, have worked in this area, are probably being done through research grants through universities that are testing various new proposed new drugs and the like, and they're being run there. But I take your point that you might not have knowledge of them within the VA itself. Some of the information, just for the record, I would provide you with some of the estimates stakeholders have given us. Since the hiring freeze by the President, and that continues to be in effect, 370 extramural studies and clinical trials, will be suspended or canceled at the VA. 10,000 veterans that are relying on these clinical trials and studies will be denied care, and the VA will lose $35 million in research funding due to delays and cancellations. Earlier today, during a hearing at Milcon VA Appropriations Subcommittee, you stated that clinical trials are not health care for veterans, that they are above and beyond health care. And I must tell you that I completely disagree with that statement, and if you wish to correct it, that's fine. But clinical trials are health care, and for those veterans, as has been mentioned earlier by my colleague, might be a lifeline for a veteran who has cancer and is in a trial, or perhaps has a neurodegenerative disease and is in a trial, and those potential discoveries, that treatment that's given during a clinical trial, and it is treatment because I have been an investigator, I know that it's treatment, that any pause or delay in cancellation of such trials is a delay in cancellation of treatment. So are you taking any steps to ensure that veterans who lost access to clinical trials will still receive the care that they need?
Yes, and I would appreciate the opportunity to clarify, because my words were taken out of context, and I think when you have to have proper context, what I said was, because I'm having to also deal with a lot, Doctor, about people who are lying about what we're doing, in all honesty. And so when you get to the point where I've had many people come up and say, dealing with research or dealing with clinical trials, saying they've lost all access to health care. This was their wording, all access to health care. That's just, I'm with you on this. It is not. It is a part of health care, but it is not, they didn't lose their access to their primary care physician. They didn't lose their access to anything else. And even if it's true, we did not cancel any of the clinical trials. And as we move forward on that, we're going to continue to do that, because they have actually provided a great deal of service to not only our veterans, but outside that veteran organization as well. And the same is true with that no research trials have been canceled. That's one of the reasons we put the pause in that we did as well for that.
Thank you, Mr. Secretary, and thank you.